Well, hello and good evening, everybody. It's Christian here again, and this will be my initial discussion post as this week we look at solution-focused brief therapy versus narrative therapy. So both of these therapies, just for a general overview, are constructivist therapy, so narrative and solution-focused brief therapy. They are both more recent additions to theory and therapy. So just kind of give a quick overview of each of these. So when we look at solution-focused brief therapy, we find that the main goal is to help clients find solutions. With this approach, it kind of focuses more on the client's strengths rather than trying to attack clients' problems. With this approach, they don't really care how the problem was brought in. They just want to focus on how the client can find solutions to said problem. And it focuses on empowering the client, their strengths, and their competencies. It's also very brief. This form of therapy normally lasts for clients anywhere from 2 to 5 sessions. So it's very brief and not like other forms like psychodynamic where it could take multiple sessions. It's brief, it's quick to find solutions, and like I said, it's often very goal-oriented. For this approach, we find that clients find their own unique solutions through a dialogue with the therapist. They are given a way to find their own solutions, and we find that the client in this particular theory, along with narrative therapy, is the expert on their life, according to this theory. So some major techniques that we find in solution-focused brief therapy include the exception question, when a client looks back at a time when they did not have the problem in their life. There's also a lot of scaling used from 1 to 5. The client can rate the severity of the problem in their life. And then there's also the miracle question. If you woke up the next day and this problem was gone, what would have happened? What would you do? Stuff like that. So that's a brief introduction to solution-focused brief therapy. Now when we roll over to another constructivist theory, narrative therapy. So for this one, it's all about the client's choice to change their narrative. Clients are given and have the power to change their life narrative. So it doesn't matter what their life stories that they've carried in or brought in with them from the past, they can rewrite their future, not based on the past. So in this approach, clients will gather social life supports, and like an example of this could be in the Christian community. There'll be many people that find fellowships and life groups and stuff like that. So with narrative therapy, it's important to construct that narrative and then allow clients to play that narrative to a quote-unquote audience, which is those social support groups that people find themselves in, to have a more positive future narrative. Some major techniques, and there's not many with narrative therapy, but we find that there's a lot of questions that the therapist will ask just to continue that story of the clients. Therapists will encourage clients to share their alternative stories. And then there's a lot of externalization in this narrative approach. Basically that the problem is the problem. The client themselves is not the problem, but that the problem is the problem. So they try to externalize the problem and then deconstruct it to reconstruct a new narrative. There are several similarities to both of these approaches, both in weaknesses and in strengths and in application. So there will be a little bit of a redundancy here, but just it goes to show how the two are very similar. So some similarities of these two approaches is we find that it's very subjective in its nature. Both of these approaches believe that the client's reality is reality. It's very subjective reality, and that's what we work out of the client's subjective reality. We also find with both of these approaches that the client is respected and regarded as the expert on their life. So we as the therapist kind of have to play, in many ways, I don't want to use the word dumb, but we come in and we just take in what the client has, and they're the experts, so we just kind of help facilitate them in that way. So that's some similarities. Some differences that we find between narrative and solution-focused brief therapy include that narrative therapy makes clients' problems external. So it's all about that externalization, deconstruction of that person's problems and story. And with solution-focused brief therapy, we find that there's a focus on finding solutions to unwanted behavior. So they don't really separate the problem from the individual. It's just all about finding those solutions to those behaviors or what's happening in their lives that they don't want. Also, narrative therapy works to change the client's perspective on certain issues, rewriting that story, changing their perspective on their future and on their life. And what we find with solution-focused brief therapy is that it works to find solutions to the client's presenting problem. So one is more focused on changing perspectives, changing direction, and changing narrative, like it is mentioned in narrative therapy. And then the other one is more focused on finding solutions to the problem. So there's a bit of a difference there. So that's the similarities and differences between the two. Now, when we look at the strengths, for both of these, there's many similarities. So the strengths, it is all about collaboration. It's a collaboration between the client and the therapist. They work hand in hand together to help the client. Like I said before, both of these, the client is the expert. A strength of the brief therapy, solution focused, is that there is many useful therapeutic tools at the therapist's disposal. They may not be certain techniques, but therapist tools that they can use and that can be integrated into other forms of therapy. And one of these is that miracle question again. You know, if it were to go away, what would that look like? So there's many useful tools. Again, the client is the expert, and it's all about their subjective reality. So that's another strength of it. And it's funny because that is also a weakness. And I have something I've listed in the weaknesses as well for solution-focused brief. And then it doesn't use clinical labels. So it doesn't make an individual feel stigmatized by a clinical label or a diagnosis. Again, this is a strength, but also when I get into the weaknesses, this will also be a weakness of this approach. For narrative therapy, again, we find there's a collaboration between the client and the counselor. It is also very useful and has many useful therapeutic tools, including the alternative stories approach, helping the client reshape their story into something more positive. Again, subjective nature, the subjective reality of the client, and the client is the expert, just like solution focused. Again, this approach doesn't use clinical labels either. And most importantly, it gives agency to the client over their own life. It makes them the expert and gives them that agency to take control of certain aspects of their life. So that's certain strengths of both of these. Now, when we drop down into the weaknesses for both of these approaches, both narrative and solution focused, it's not technique driven. You know, there's some therapeutic tools that the therapist will use, like those questions, but it's not very technique driven, which can make it hard to predict outcomes in client treatment. Another weakness is that at certain times there is not enough emphasis on the therapeutic relationship, with these being very brief therapies. Sometimes that alliance, that warm, caring therapeutic alliance that Carl Rogers talks about, can be neglected, which is not a good thing because we know that is the foundation of therapy. Also, there is not enough information or specialized knowledge from these two therapies or theories about how to treat mental disorders. So if someone has a severe mental health problem like schizophrenia, personality disorder, extreme depression or OCD or things like that, these certain types of approaches might not have the specialized knowledge to treat these disorders. So that's something to take into consideration when working from these therapies. And again, for both of these, in many ways, there's not enough empirical evidence to support the usefulness of these two approaches on treating such disorders or treating certain things. And then lastly, for weakness for both of these is that it doesn't adequately deal with certain life issues, especially with solution-focused brief. If you have mental dysfunction, like I said, severe disorders, or if you have traumas that you need to work through, the solution-focused may not be the best approach. And then when we look at narrative, again, there's not enough specialized knowledge on dealing with certain mental problems and not enough evidence. So those are some strengths and weaknesses of both the narrative therapy and the solution-focused brief therapy. Now I'm going to continue on here, and we're going to look at how it compares to the Bible. So one main way that both of these approaches compare to the Bible is that there is a need, and this is especially with narrative therapy, there is a need for community support. There's a need for community support for an outpouring of positive growth in the client's life. And we see that in the Bible as well, that we need to have community, like I mentioned earlier, in churches and in life groups to really be accountable in the life that we want to lead. So that is one way that it is compatible with the Bible. Now, from reading, especially in the Tan book, we find that there's many ways that these approaches are not compatible with the Bible, and I've just listed a few here. We find in these approaches that the clients are the experts, and they can find ways to deal with their own problems. But in the Bible, humans are not self-sufficient. Our help, as we know as Christians, comes from God. So there's a bit of a contradictory thing there. We also find that I just mentioned earlier that there's subjective truth on the client's part. And we know as Christians, there is an objective truth, which is God's word. That is the objective truth. So again, there's a bit of a clash there. We also find that we're called to love one another in a way that reflects the love of God. And again, if there's not a warm therapeutic alliance because these therapies are so brief, then we can't nurture and foster or allow that therapeutic alliance to grow, and that warmth and that care. And we can't really sit with the client in their pain, in their suffering, because it is so brief. So that's just some ways that it is incompatible with the Word of God. Lastly here, I just want to go over some limitations to setting client outcomes, especially when it comes to psychopathology. Something interesting that I found about these two approaches, and I'm sure everyone else has found that as well, that they don't label, they don't diagnose. The client themselves is unique. So they don't like to put clinical labels on things, and they don't like to diagnose, which really makes it hard to identify psychopathology and treat psychopathology. Yes, the client's story is subjective and it's their reality, but certain mental health disorders have certain things that go along with it. And if you don't diagnose it, then it might be harder to treat, therefore making problems and setting client outcomes in their treatment. Again, there's not much empirical evidence to treating certain more severe disorders, which could again make it harder for certain clients to make certain outcomes. And then with certain mental health disorders, especially the more extreme ones, some clients might not be able to come up with their own solutions. This is more geared towards solution-focused brief therapy. Some people that are very mentally unstable at times due to the condition that they're suffering through, they might not be able to find their own solution. So they may need more an active approach in therapy. So that's another thing to consider. And then lastly, since it is client-led, sometimes the clients may get off track on certain things that may not need to be focused on, and focus on other things that they might think is important, but it might not be beneficial to therapy. So sometimes direction from the therapist is important, and just to remember that in this approach. So these are just my thoughts for this week as we look at solution-focused brief therapy versus narrative therapy for this week's discussion. Thank you so much for listening, and have a blessed week.